Summary of Chapter 12. The Monster Leptin Reset thread at Mark's Daily Apple. Chapter 12, written by Colleen Coble, details the transformative health journeys of 5 individuals: Colleen, Jonathan, Ivy, Gretchen, and Dexter, who used Dr. Jack Kruse's EPI-PALEO RX and leptin reset principles shared via Mark's Daily Apple forum and Dr. Kruse's blog to address various health challenges. These stories highlight how evolutionary medicine, focusing on diet, hormonal balance, and lifestyle changes, help them overcome obesity, chronic illnesses, and other health issues. Colleen's story, background: a fiction author with lifelong weight struggles, Colleen faced obesity, migraines, fibromyalgia, celiac disease, and food allergies after a hysterectomy at 23. Despite numerous diets, her weight and health issues persisted, with daily migraines dominating her life. Journey: addressing candida, food allergies, and using bioidentical hormones resolved her migraines. She lost 75 pounds on the HCG protocol, dropping from size 20 to 8. In 2011, Dr. Kruse's leptin reset eliminated hunger, improved sleep, energy, hair, and skin, and stabilized her weight. Lab results showed significant improvements, e.g., C-reactive protein from high to 0.1, cholesterol from 130 to 200 with HDL at 70. Key takeaway: the leptin reset addressed the root cause of her health issues, enabling weight maintenance and better health through a low-carb, high-protein diet. Jonathan's story, background: starting at 506 pounds, Jonathan faced obesity, epilepsy from childhood abuse-related head trauma, sleep apnea, and depression. Extreme diets and exercise failed to stop his weight gain, worsened by low testosterone. Journey: after losing over 100 pounds on the HCG protocol, he adopted a ketogenic Paleolithic diet and leptin reset principles. This improved sleep, testosterone, body composition, and stamina, reducing his weight to 361 pounds. Depression nearly vanished. Key takeaway: the leptin reset and ketogenic diet provided a sustainable path to health, shifting focus from calorie counting to hormonal balance and real food, e.g., grass-fed meat, canned salmon. Ivy's story, background: a mother of 3, Ivy battled fatigue, depression, weight gain 190 pounds post-pregnancy, and gut issues, candida, gluten sensitivity, lactose intolerance, from a high-carb diet. Journey: after a nothing diagnosis for abdominal pain, she adopted a primal diet via Mark's Daily Apple to heal her leaky gut. Dr. Kruse's blog clarified her leptin resistance and mineral deficiencies. The leptin reset, with high-protein breakfasts, eliminated hunger, improved energy, and led to a 46-pound fat loss in 7 months. Key takeaway: the primal diet and leptin reset reversed dietary damage, restoring vitality through gut healing and hormonal optimization. Gretchen's story, background: discharged from the Air Force in 1999 due to asthma and migraines, Gretchen was diagnosed with PTSD, bipolar disorder, fibromyalgia, and chronic fatigue syndrome. Medications caused 30-pound weight gain, and her weight stalled at 190 pounds post-pregnancy. Journey: the primal blueprint helped initially, but a plateau persisted. In 2011, the leptin reset revealed high nighttime cortisol and pregnenolone steal syndrome. Correcting cortisol with adaptogens, quitting coffee, and adjusting exercise led to a 10-pound loss, 160 pounds, and size 8 pants. Body composition and mental health improved. Key takeaway: addressing hormonal imbalances, cortisol, thyroid, via the leptin reset and circadian rhythm optimization overcame her weight plateau. Dexter's story, background: at 64, Dexter faced obesity, 36% body fat, and declining physical ability. A former softball player, he struggled with Dunlap disease, belly fat. Journey: a low-carb diet and strength training reduced his body fat to 25%. P90X dropped it to 20%, but soreness prompted further research. Dr. Kruse's leptin reset, with high-protein breakfasts and healthy fats, coconut oil, lifted brain fog, and led to 160 pounds at 12% body fat. A sleep study diagnosed sleep apnea, treated with CPAP. Key takeaway: the leptin reset and dietary changes transformed his health, proving food choices can alter outcomes even later in life. Overarching themes: EPI-PALEO RX and leptin reset. Dr. Kruse's principles, centered on ketogenic/primal diets, high-protein breakfasts, healthy fats, and circadian rhythm alignment, address leptin resistance and hormonal imbalances, improving weight, energy, and health markers. Community support. Mark's Daily Apple and Dr. Kruse's blog provided a virtual community for sharing experiences and motivation. Individualized approach. Each journey required addressing unique hormonal, dietary, or health issues, e.g. cortisol, thyroid, gut health. Beyond weight loss, the focus shifted to overall health, mental clarity, and longevity, with benefits like reduced depression and better sleep. Challenges of adoption. Resistance to non-mainstream approaches limited adoption, but committed individuals saw life-changing results. Conclusion: the chapter illustrates how 5 individuals overcame diverse health challenges: obesity, migraines, PCOS, fibromyalgia, depression, using the EPI-PALEO RX and leptin reset. By adopting primal/ketogenic diets, addressing hormonal imbalances, and leveraging community support, they achieved weight loss, resolved chronic conditions, and gained vitality. The stories emphasize empowerment through self-education, persistence, and a mindset shift, encouraging others to try the protocol for 30 days. Summary of Chapter 13. Proof that the EPI-PALEO RX is the Paleolithic diet of all time, by Dr. Jack Kruse. This chapter recounts Dr. Jack Kruse's personal and professional journey in discovering the power of the EPI-PALEO RX, a modified Paleolithic, ketogenic diet, in combination with cold thermogenesis, to treat chronic pain, improve post-surgical recovery, and potentially reverse Neolithic diseases. Key concepts. 1. Leptin as a master regulator. Kruse hypothesizes that leptin, a hormone involved in fat regulation, is central to reversing modern diseases. He believes leptin resistance is the root cause of many chronic conditions. When leptin sensitivity is restored through diet and cold, inflammation drops, pain decreases, and healing improves. 2. Cold thermogenesis and pain control. Through personal experimentation, Kruse discovered that exposure to cold, such as ice baths, rapidly lowers inflammation and pain by influencing hormonal responses, especially lowering IL-6 and increasing alpha-MSH. He tested this on himself after inducing leptin resistance and undergoing painful plastic surgery, using cold alone, no painkillers, for recovery. 3. Evolutionary biology and cold adaptation. Kruse connects his findings with the KT extinction event, which he theorizes forced mammals, especially placental mammals, to evolve leptin-controlled mechanisms to survive cold, dark environments. He argues this evolutionary adaptation is embedded in our DNA and explains why humans thrive on cold, ketogenic environments. 4. Clinical observations. Kruse applied his theories to neurosurgery patients with spinal issues and chronic pain. With dietary changes, high DHA ketogenic diets, cold therapy, and vitamin D optimization, patients recovered faster, required fewer narcotics, and experienced less inflammation. 5. N=1 self-experiment. Music City Miracle. Kruse deliberately made himself leptin-resistant by eating processed foods, underwent plastic surgery, and then used ice therapy instead of drugs to prove cold could reverse pain and restore leptin sensitivity. His experiment supported his hypothesis. Cold eliminated pain rapidly and suppressed hunger and thirst. 6. Broader implications. Cold plus ketogenic diet equals reduced appetite, pain, and inflammation. May benefit longevity, diabetic neuropathy, fibromyalgia, failed bariatric surgeries, and more. 1. Cold environments may be the primordial human condition, and modern warmth may be mismatched with our optimal biochemistry. 7. Factor X and epigenetic speed. Kruse introduces Factor X, the idea that cold environments accelerate epigenetic adaptation, making evolution faster. He believes this principle shaped the human leptin receptor and supports the EPI-PALEO lifestyle. Conclusion: Dr. Kruse combines evolutionary biology, clinical insight, and self-experimentation to argue that a cold-adapted, high-fat, marine-based ketogenic diet, the EPI-PALEO RX, is humanity's optimal dietary and healing path. He believes this model can treat modern diseases, manage pain, extend life, and align us with our ancient biological blueprint. Summary of Appendix A. The EPI-PALEO RX Diet. Appendix A outlines the EPI-PALEO RX diet, developed by Dr. Jack Kruse, rooted in evolutionary biology to optimize human brain function and health. It emphasizes a marine-based diet rich in DHA, iodine, and iron, which drove human evolution from transitional apes in the East African Rift Zone. Evolutionary context: origins. The diet draws from the KT event, 66 million years ago, which forced mammals to adapt to a cold, marine-based diet, and the East African Rift Zone shifts 10 million years ago, providing nutrient-rich marine foods. These enabled bipedalism and brain expansion. Key nutrients: iodine via thyroid hormones T3/T4, supported bipedalism and brain growth. DHA and iron fueled cognitive development. Modern deficiencies, e.g., 1 billion lack iodine, impair brain function. Human brain uniqueness. Human infants have high fat stores, unlike lean chimp infants, to support energy-intensive brain development, 75% of infant energy. Ketones from fat are vital for brain growth and myelination. Dietary principles. Core philosophy prioritizes seafood and fats to mimic the ancestral marine diet, viewing food as hormone information that regulates the brain-gut axis. Ketones versus glucose. Ketones, produced from fat in low insulin states, are superior brain fuel, supporting infant brain growth and organ protection in cold environments. Epigenetics. Diet and circadian rhythms influence gene expression more than genetics, making nutrient-dense foods critical. EPI-PALEO RX Diet Guidelines. Macronutrients. Proteins, ordered by brain benefit: shellfish, oysters, crustaceans, fish, offal, grass-fed meats, pastured eggs, if no inflammation, omega-3 nuts/seeds, if tested. Fats: spring, summer, coconut oil, ghee, palm oil, duck fat, tallow, olive/avocado oils. Fall, winter, animal fats, ghee, butter, tallow. Use MUFAs with seafood, saturated fats with non-seafood. Other components: seafood/bone broths, fermented vegetables/probiotics, sea vegetables, e.g., kelp, arame, for iodine and detoxification. Foods to eliminate: grains, U.S. dairy, A1 casein, nightshades if inflamed, out-of-season fruits, legumes, saponin foods, e.g., soy, sweeteners, except pure stevia. Limit poultry, except duck. Circadian/seasonal eating. Align food with circadian cycles and local seasons. Health benefits: brain function, provides brain-specific nutrients to rebuild neural circuitry, reducing cognitive/psychiatric risks. Inflammation control, minimizes inflammation, supporting hormonal balance and epigenetic expression. Gut health, optimizes gut flora, enhancing nutrient absorption and reducing disease risk, e.g., colon cancer. Specific conditions: sea vegetables address hormonal imbalances, e.g., PCOS, thyroid disorders, herpes outbreaks. Key differences from paleo diet: paleo controls inflammation but lacks EPI-PALEO's marine food focus. EPI-PALEO targets serious diseases with brain-specific nutrients. Conclusion: the EPI-PALEO RX is a marine-based, nutrient-dense diet replicating the ancestral diet that shaped human brain evolution. By prioritizing seafood, fats, and sea vegetables while eliminating inflammatory foods, it optimizes brain function, gut health, and hormonal balance. Dr. Kruse advocates it for chronic conditions, urging readers to adopt it and share results on his blog, www.jackkruse.com. Summary of Appendix B. The Cold Therapy RX. Appendix B introduces the Cold Thermogenesis (CT) protocol, an advanced addition to the EPI-PALEO RX diet, developed by Dr. Jack Kruse through an 18-month biohack. It uses cold exposure to enhance fat loss, leptin sensitivity, and health by rewiring hypothalamic signaling to burn white adipose tissue, WAT, and induce brown adipose tissue, BAT. Purpose and benefits. Objective. CT induces fat cell apoptosis, rapidly restores leptin sensitivity, and promotes permanent fat loss. It improves sleep, reduces chronic pain, and supports conditions like gastric bypass, type 2 diabetes, adrenal fatigue, and metabolic syndrome. Mechanism. Cold liberates leptin from fat cells, enhances fatty acid/ketone supply to muscles, and reduces glucose uptake, mimicking evolutionary cold adaptations. Additional benefits. Increases metabolic rate, 30 to 40%, activates longevity genes, improves exercise recovery, reduces hunger, and may help binge eating disorders.
Who needs CT?
Beneficial for those with leptin resistance, chronic illnesses, or high body fat, but not mandatory for all. Protocol overview. Gradual implementation. Add CT slowly to EPI-PALEO RX, starting safely to avoid risks like frostbite. Prerequisites. Ensure low cardiac risk. Consult a doctor. Eat high-fat/protein meal and CTs, saturated fats. And drink 16 to 32 ounces ice-cold water. Burn 60 calories for 2 liters. Environment. Cold water is preferred, 24x more effective than air. Avoid metal cooling for safety. Step-by-step cold adaptation 1. Step 1. Face immersion. Submerge face in ice-cold water, 50 to 55 degrees Fahrenheit, without makeup. Monitor skin temperature. Increase duration over 2 weeks until breath-holding limits. 2. Step 2. Torso cooling. Wear compression shirt, apply 20 to 40 pounds double-bagged ice to torso. Extend sessions to 60 minutes. Remove shirt, apply ice directly, checking for cold urticaria, high omega-6. Stop and follow ketogenic diet. Maintain pink/cherry red skin. 3. Step 3. Cold tub immersion. Fill bathtub with cold water. Add 20 pounds ice to chest/abdomen. Wear socks/gloves/cap initially. Gradually remove these. Increase ice, 10 pounds at a time, for 45 minutes at 50 to 55 degrees Fahrenheit. Revert to face immersion if lightheaded. 4. Step 4. Maintenance and outdoor training. Maintain CT 2 to 5 times weekly after 1 month indoors. Use pools/lakes/hot tubs. 4. Targeted fat loss, neck/face. Ice torso in warmer water. Monitor skin color. 5. Step 5. Outdoor cold exposure. Spend time outdoors in cold with minimal clothing to boost calorie burn, 3 to 7% from skin/air warming. Stay outside post-CT, then use warm robe for extended burn. 6. Step 6. Air adaptation. Gradually remove clothing, starting with face/head to trigger mammalian dive reflex, slows heart rate. Rewarm in order. Face, head, extremities, torso, to avoid cortisol spikes. Key considerations: safety. Keep skin at 50 to 55 degrees Fahrenheit to avoid core temperature drops. High omega-6, smoking, dehydration, or high-carb diets slow adaptation. High omega-3 and protein/fat diets improve it. Mammalian dive reflex. Cold face exposure slows heart rate, enhances adaptation, rooted in placental mammals. Caloric burn. CT burns significant calories, 3,800 in 3-hour session versus 2,600 for marathon, with less long-term harm. Evolutionary basis. CT taps ancient mammalian cold adaptations, predating exercise-based metabolism, activating novel pathways and longevity genes. Conclusion: the cold thermogenesis protocol enhances the EPI-PALEO RX by using cold exposure to drive fat loss, leptin sensitivity, and health improvements. Through gradual adaptation via face immersion, torso cooling, and full-body immersion, it rewires hypothalamic signaling. Its evolutionary roots and clinical applications make it transformative for chronic conditions or fat loss, offering benefits like improved recovery, sleep, and longevity. Dr. Kruse encourages safe implementation and sharing results. Summary.